Welcome, Deanna.
Hi, Alex. It's great to be with you.
It's good to be with you too. We've had some tech trouble getting into this recording, so we're here now. Glad to see you. So please tell listeners of the podcast a little bit about who you are and what you do and how you found your way into continuing medical education.
Sure. Well, I could definitely consider myself one of the lucky ones to have found my way into medical education. I was actually a scientist. So I was a biochemist at Emory University getting my doctorate and was on that path of becoming a professor and fell in love with just the writing and presenting side of science and kind of translating what was happening in the lab to different audiences, whether they were students or professors, and learned about medical communications and education as an alternative career towards the end of my doctorate research, and went into freelancing with some mentoring from others, and just found a love for just intersecting science and communication. And that's where I come from. So it's a little bit of a different background maybe than others.
And yet it's probably a background that a lot of listeners share, especially listeners coming from academia, coming from a clinical practice background. So I want to dig in just a little bit more to, you said a couple of things there. One is you found out about CME toward the end of your postgraduate. So how did you find out about it?
Yeah, so actually I started in news writing. So, a lot of us get to go to conferences, present our research, and I was at the ASCB, the Cell Biology Conference of the year, and met people who were doing news writing at the conference, and ended up then working with Reuters and MedWriter, DocWriter, a few of the groups at the time that were covering medical conferences, and then moved from doing science conferences to the medical conferences and started learning a lot about the clinical trials and all the advances going on the medical side. And it built from there. Just really felt, as I said, really lucky to have found something I was really passionate about and could carry forward outside of the lab. And it turned into medical education. So luckily, with a Ph.D. background, I was able to get into the field of medical education by understanding the science behind it and coming from academia, understanding some of the faculty perspectives, and just really loved working with the faculty to teach. So I did get to teach a little bit also in my graduate work. And so being able to combine just what I learned about course design and course development and adult learning theory and leading that towards a career in medical education. That's how it all started. And so it's fun to think about it 20 years later, how we all come about from different backgrounds.
Absolutely. But you carry those key skills with you and you're able to put them to good use, transferring them from one setting to another. And I think that's something that certainly a lot of writers, maybe other people working in this field as well, worry about a little bit are the skills that I've developed in this other setting, whether it's academia or bench science or clinical practice, transferable to the continuing medical education space. And I think what I see again and again is absolutely those skills are transferable. You just need to explore what the right niche or niche might be for you within CME. Can you tell us a little bit about what you're doing now, what your current work involves?
Yeah, so as I said, I've been doing CME now for about 20 years, and so moved from medical writer into developing programs with faculty, putting together mostly online medical education, and worked in oncology, cardiology, and now I found myself in the field of radiology, which I'm really finding fascinating. So a lot of the work I was doing before was more on the treatment side, and now working more in the diagnostic side, and just really seeing the huge impact that education can have in the diagnostic setting and setting patients on the right path for their treatment plans that result from imaging a lot of times. And I'm currently at Medality, and this is a startup company that I joined just a couple years ago. And we basically have been putting together a very different type of educational platform. It's called a practice development platform. And so it's an online training tool where basically you come on and you're able to actually work through cases. And so it's a simulated case-based type of educational format. So you're not just reading about it or listening to somebody talk about how to do it, but you actually get to apply your own skills while you're going through the cases, which I'm just finding really fun. We do it in a very engaging way. The radiologists love it, and they get to do it in a safe environment. The thing about the best learning, right, what we all know, is that it has to be this safe environment where somebody can come on, try things out. They're learning from the experts as they're doing this, and you don't have the risks that you have in clinical care. If you do make a mistake, you can learn from it in that safe environment.
So can you talk a little bit more about how the cases are developed and how they're presented to the learners? What's involved in that process?
Yeah. So what's really interesting is it's a very apprenticeship-based type of model in radiology, where the more cases you see, the better you are, right? Your eyes are trained by following certain search patterns, and that leads you down the right path, right? And then once you find a lesion, how to characterize it appropriately and efficiently. And so what our model does is we work with faculty who actually go through the same case that the learner has in front of them. So in radiology, the environment is at the computer or at their workstation, which works really well for an online learning format. So they can actually pull up and read alongside the expert. So you're watching the world's expert in, let's say, neuroradiology, go through a brain CT, and you have that same exact CT open, and you're able to walk through it in the same way that they are. So it's that learn by doing side of education that we know is really most effective.
And is that synchronous? Is it real time, or is it has the faculty already pre-recorded the case? And how does that work?
So we do it both ways, actually. So most people right now like asynchronous models, learn as you have the time. It's also a microlearning model. So each case is somewhere between 3 and 7 minutes long that they're going to watch that video. And so they can just work through as many cases as they like on their own time. So those sessions are pre-recorded. And then we also have synchronous models where you go through the cases and then you meet with the faculty member and they talk through what you missed. Because the other aspect of radiology, which is really fascinating, is it's not just how good you are at finding the lesion, but you then have to communicate it to the referring provider, right? So there's a whole communication and reporting side of skill development that they need to have. So we also help people in that setting as well. So they'll review a case, they'll write a report, and then they'll get personalized feedback from the faculty member to grade them and help them with the language that they're using in their reports to make them the most effective.
So how many faculty do you have to partner with in order to, or collaborate with in order to get the volume of feedback that you need for all these cases or all these learners?
Yeah. Well, that's the really fun part. I love working with our faculty. Just through the years, it's been really great. And so we have over 300 faculty that we've worked with just in the last 3 years. Yes. In radiology, there tends to be subspecialization. And so a faculty member might be a neuroradiologist, or they may be an expert in breast imaging. And so depending on the type of course that we're teaching, we would work with a different faculty member, and then they would run through a series of those cases along with the students.
And what's your process for identifying faculty? Because that seems to be a bit of an art in its own terms, and also identifying faculty in a way that builds in some diversity to your faculty. Yeah. I imagine that's something that is important in everything, but obviously in radiology, where you're really focusing on perspective and interpretation. Yeah.
You touched on a couple really important things. So the way we identify the faculty, the great thing, and I don't know if this is radiology specific, but there's a lot of mentorship value in radiology because it is so apprenticeship based. Like in residency and fellowship, they're literally sitting side by side reviewing cases together. And there's a lot of great educators because there is a more personal experience that they have in that training setting. Yeah. And so we've been able to find some really great faculty that just love teaching, and teaching by cases is even easier, right? Because that's what they do day to day. That's what they love doing. You don't have to make a 200 slide PowerPoint, right? You can just do what you know. You do what you know, and you know it best, and you're just teaching the next generation. It's not even generational, though, internationally. So the model's more accessible than a lot of other training programs. So usually people will have to go on site to get this type of training, but we have radiologists all over the world that are interacting with faculty here in the US and abroad. And it's to help with the diversity aspect that you were saying, like we're really reaching a lot of people. And diversity is something that I think they are challenged by in radiology. It is definitely a more male-dominated industry. And some of that's changing, though. So we've partnered with groups like the American Association of Women in Radiology recently to make sure we're getting faculty representation in our learning platform. And that's been a really great partnership. And that's something just internally at our particular company that we're really striving to make sure we have diversity in our faculty.
Deanna, is that unusual in CME to have a very specific and strategic approach to faculty diversification?
I wonder. I've definitely felt it more at my current company that we are committed to having more voices at the table. I think radiology is just such an interesting field, particularly after going through COVID. They've been very advanced in teleradiology also, and just being able to continue to do your work during the pandemic. I feel radiology was one of those fields that was able to adapt. And actually, our company started the year of the pandemic. And so faculty were looking for ways to teach. They wanted these online models and how could they replicate that side-by-side training experience in a different way. And so that all came together for us to be able to keep teaching and keep getting the education out there even during that time.
Yeah, it's interesting how some of the ways that the pandemic has really forced innovation, different and more doable and workable ways of actually doing things, doing education. Something you said earlier that I wanted to just pick up on, because a lot of your work obviously involves working with faculty. And you said earlier that's one of the things that you really enjoyed as you moved from writing to working more strategically with faculty. Can you talk a little bit about what that shift looks like? Because I think for a lot of people who end up in continuing medical education, faculty can seem a little bit, the idea of working closely with faculty can seem a little bit daunting and challenging. So what kind of mindset do you need? What kind of skill set do you need in order to work productively with faculty to get the right content for your programs?
Yeah, I guess I never thought about it, but the way I like to approach it is I want to learn from them, putting myself in that position of being the learner who's going to be listening to them and approaching it by wanting to really understand the topic through their eyes and their teaching. And so coming at it with that mindset that you're there to learn from them, but you have to understand what you bring to the table also, right? So they have the subject matter expertise in their medical specialty, but you're bringing your subject matter expertise in how to put together a great course, how to succinctly communicate the educational teaching points. And some faculty are better at that than others, right? So being able to know that's what you bring to the table and what they're bringing to the table will make it a better course overall. So I've just been really lucky to work with people who are in it because they love to teach, they love to educate, and then they end up educating me, which helps me to be a better writer, a better CME manager, to be able to develop these programs.
And in the space that you're in with radiology and the practice-based model that you're developing at your company, how do you approach assessment? What kind of assessment framework do you use? How do you apply that in practice?
Yes, well, this is actually a huge area of innovation for us right now. It's one thing to have a great educational model that people are telling you they like and it's engaging and they love it, but really being able to assess how they're doing, helping them to actually develop their skills is where we are currently at. So we actually work with imaging practices and hospital systems to help their radiologists develop their skills. So an interesting challenge that they have in radiology is it is a multi-specialty type of medical specialty. So you are a radiologist and you might have to read a chest x-ray and then a brain CT. So you may be reading all different things in your given day. And you are going to feel more confident at reading some of those than others. That your employer is expecting you to be able to read all of these different types of scans. And so we are able to help those radiologists develop that confidence. If you haven't really read something since you were in residency, you're not going to feel as confident and you may miss something. And so they are able to then work within our learning format to learn that specialty, gain that confidence, get more accurate, make sure you're not making misses, and then really get more efficient at it also. Radiology is a little more business minded than maybe some other medical specialties. So there's a lot of data and metrics of how efficiently they can review their cases. And that's the area we've focused in. So we are looking to improve their confidence, their accuracy, and their efficiency because the volumes are increasing and there's a shortage of radiologists. Really helping them to know what to do when I get that type of case. I've seen this before. I know exactly what my search pattern needs to be, and they come out more confident and more efficient. So assessment wise, I think was your original question. What we are doing. So what we are able to do is starting at the very beginning, we do a needs assessment with the clinicians. And so we get a gauge from them. Hey, which of these subspecialties are you feeling more or less confident in? So some of it is a little bit about them knowing their own skill set, the level that they're at, and then finding the areas where they're not confident, but they are interested in education. And we connect them then to the right training courses. We can then assess them because they're looking at the cases. We can assess whether they got the diagnosis right and how long it took them. And then we can put them through the training course and assess them again on how well are they able to do, let's say, spine MRI cases. And so we are able to actually show them progress as they're doing training. So it's not all going to happen at once, right? Everything is a continuum. And so they're continually developing through this practice-based model. So that's where I get really excited, is just seeing how we can have that impact, because we are seeing how much improvement is happening the more cases they get through.
And if you're working with, rather than working with an amorphous group, you're working with specific settings to help them with those productivity metrics that you talked about earlier in terms of efficiency and speed and so on. Two questions there. One, to do with the needs assessment itself. Are you taking a different approach, or what kind of approach are you taking to the needs assessment process? Because presumably you have access to kind of people on the ground, as it were, versus having to rely reasonably heavy on the literature and what's already out there in the published domain.
Yes, it is a little different than we traditionally think of needs assessment because it is more practice-based. So we are able to tell from the individual, we're able to know what that specific radiologist needs are and connect them to address that gap that they're having, right? So we can do it at the individual level, but then we also do it at the practice level. So for instance, chest pain guidelines changed last year. I'll just give an example. And it has led to increasing volumes in cardiac CT. Not a lot of people were seeing a lot of cardiac CT. And now because of the increased volumes, more people need to get confident at that. So we know from the literature, from changes in guidelines, that now there's this gap in the number of readers that are going to be proficient at reading cardiac CT. And we can now train more people in that so that they're ready as those volumes increase. And then finally, just as we work with the different imaging practices, we really get great insights into what their needs are. So let's say they want to start up a nuclear medicine division, or they want to accept new contracts in breast imaging. They are able to enroll their radiologists in our training programs. And so they can meet those specific types of needs that they have as a business as well.
Right. Oh, that's so interesting and quite distinct. So I want to get to outcomes, but before that, you mentioned about tracking individuals through their progression, their learning progression, and their competence growth. So how long would a learner stick around in your learning world?
Yeah, we've been doing this for 3 years now as a company, and basically the way that they enroll is annually. So people have come back year after year to continue doing courses on the site. We've also been able to expand into new areas. And so because there are so many subspecialties within radiology that they need to feel confident in, we're able to keep developing content that's relevant to a radiologist because they have to know so much. It's really a fascinating field, how much they have to know. And I think your question was just how long do people stay? What's nice is because of that microlearning model I mentioned, they can review little by little, just whenever they have time. And we've heard some pretty funny things, people doing it during Super Bowl commercials, that they're really fitting it in, because that's the hard thing about any continuing professional development is how do you fit it in? And it has to become more of a lifestyle, right? You want to learn and you have to fit it into your daily routines. And that's what we try to really do with this model, to make it really accessible, because nobody has time. People don't have as much time to go to conferences and on-sites that take you away for days. People maybe don't want to do that anymore and be away from families. And this allows them to just do it at their own pace. Yeah.
So that you used a particular phrase about lifestyle learning, or maybe I concocted that, but you did say something about lifestyle. And so that's really interesting because on the one hand, you often hear clinicians talking about, they have to do CME and CE, but it becomes a bit of a checklist. So on the one hand, on the other hand, particularly from the CME community, we want to promote the idea of lifelong learning and reinforce that. And so that idea of lifestyle learning is interesting. And one of the things that strikes me there is if you are doing your ME while you're on the soccer field watching your kids play soccer or football, I'm from Scotland, so we call it football. What role does distraction? There's the potential for distraction as you're learning is potentially high there. Is that something on the radar when you're designing microlearning activities?
Yes. And I think that has a lot to do with what stage you are at in your learning about a topic, right? If you're pretty early and it's a new topic to you, you really want to be very focused. You'd probably want to take that whole course from the beginning to end. And we do see that pretty commonly with our beginner learners. But sometimes it's about reinforcement, right? And so you just need to have that consistent reinforcement throughout your development. And you had mentioned about CME being a checklist. And throughout my career, it is so true. Some people, you offer CME, but most people aren't really doing it for the CME. There's something else that's bringing them to these educational courses. And we're finding that as well. People they picked their profession, right? Because they like it, we hope. And so they just really love seeing cases. Radiologists love seeing cases and they love hearing other people's perspectives on a case. And hey, what did I think about this? How does that compare to what this other person thought about it? And so if you're going to do CME, so let's say it is a checklist item, you might as well do one that you like and that is fun and engaging, instead of just feeling like you have to turn on this lecture for an hour so that you can get a CME credit. And that's something we talk about a lot with our imaging practices is they have to get certification. So radiologists have to be certified also in ultrasound, or mammography has federal requirements about how much mammography CME they have to take. And so if you have to meet these requirements in order for you to be credentialed, you might as well have your radiologist do them in a program that's actually going to have a practice impact. So instead of sitting in the room and learning, I don't know, about research that maybe will happen 20 years from now, you could have them actually do something that could affect the case that they see tomorrow. And so there's a little more of that immediate impact that this type of CME can have that's resonating with people, that it's just more relevant, I think, to what they're doing day to day.
Well, it's the gold standard of professional development and adult learning, isn't it? That what you're learning has immediate translation into the practical issues in front of you. And so it sounds like a very happy marriage.
I know.
or a partnership.
I see it. I do. I see it a lot. I used to educate a lot on clinical trials. And so we'd get very excited about the latest data that would come out at CROI or whatever conference we might be at. And then you'd talk to community infectious disease doctors. They're not doing that in their day-to-day yet, right? But there's a big leap from when we all know from when it gets FDA approved to when it's actually used in practice. And so we are more focused on what are people doing now in day-to-day practice so that we can start bringing that information in at the right time when they need it, instead of it feeling separate and research-based.
No, it's really exciting actually to think about that. Outcomes. What kind of outcomes are you seeing with that model of assessing in place and providing that reinforcement, the feedback, and the safe space to learn?
Yeah, this is where I got really excited. And when I knew I was hooked here is we started pretty simply with course evaluations. We asked questions subjectively about how do you feel like you have gained confidence? Do you feel like you're more efficient? And scores were in the 98%, 99%, and comments that they would make were just how this was like nothing they'd ever done before. Pretty early on, knew we were onto something, but that's all subjective. And so I really wanted to see the more objective data. And we have started doing that now with our needs assessment approach that I mentioned earlier, where we're able to actually assess, did they get the diagnosis right? And how long did that take them? So we put a cohort through. So we are doing a little bit of research and case studies on our end now that we have these models. And we put a cohort through our spine MRI training course. And we were able to show both an increase in efficiency and an increase in their accuracy, right? So we reduced the time it took them to go through spine MRI cases, which are pretty complex cases that they might see. So there's that level where it's, okay, now we're starting to see that objective data that validates what we were seeing from the subjective data. But also we can look at each individual, right? So we can do the scatter plots, and it's just so validating to see how it moves forward, right? Like we're able to take each individual doctor and see their progress through that training module. So yeah, we're pretty excited about the data. We're actually going to be publishing some data soon on our site about clinical needs that we have gathered from. So we have 3,000 radiologists have come through our programs. And so we are able to take some information about their clinical needs to really understand what radiologists are needing, what type of education, where are they confident, where are they not, and how we can move the bar. So it's still early, but pretty exciting on what we can do.
How applicable do you see this practice-based model to other specialties within not only medicine, but pharmacy and possibly nursing too?
Yeah. So that is our goal, I will say, for the long term, is to really take what we're learning in radiology and figure out how we can apply this to other medical specialties to really provide this kind of simulation, case-based type of learning outside of imaging. So obviously, imaging is important not only for radiology, but actually if you move into cardiology, move into OB. So imaging touches every single medical specialty when you start to think about it. It all starts with a scan. And so we're thinking a lot about how we take it from here to be able to help other medical specialties as well. And that we'll see where things go. That's my background. So at other companies, I really love to develop models where you start and you build a great educational model, and then you have to figure out how to adapt it then for different medical specialties, for different types of learners and audiences, to your point. In radiology, there's also sonographers, technicians. There's a whole team involved in a lot of, and so they need to get the same type of education and training. And so we're excited to see what goes.
Yeah, and so that's all within the kind of imaging world. I guess I was thinking, that absolutely makes sense. I guess I was thinking about other specialties that aren't image heavy, but still perhaps there's the possibility or the potential for that kind of practice-based model where they're thinking about cases, reviewing cases, addressing cases in either synchronous or asynchronous time and getting that feedback from faculty in a much more granular way than most CME programs allow for at the moment.
I think so too. Right now it's about reviewing a scan. It could be a pathology slide. It could be a patient interaction, and you're getting feedback on how you interacted with that patient. And it could be in the surgical suite. I think there's a lot of places that we could take this model knowing that it works, right? The more that people learn and practice in these safe spaces, the better they're going to do in those real world settings. So I do think there's a lot to what we're learning in this field that we could apply to other fields.
It's really exciting. Anything we haven't covered that you want to share with listeners before we close out?
Yeah, well, I just really appreciate that we connected, Alex. The freelance side, we talked just a very little bit about it, but it is an incredibly wonderful field for those of you who are in freelancing. And I encourage people to reach out to each other, because that's how I got here, was just building up a network of people who cared a lot about providing good medical education and really understanding what type of education was getting out there. And yeah, just really encouraging people to learn new things, to keep learning, and that's going to keep elevating the whole field.
You've got to be a lifelong learner to work in a community of lifelong learners, and a community that supports lifelong learning.
Yes. Yeah, definitely. And that, I guess, just the final point I'll make, that's the piece I love so much about what we're doing right now, is that we talk about a lot of theory, adult learning theory and CME, and this is a chance to really take somebody's need, right? Fill it with that education that they practically need for their job the next day, and to see that outcome. And I just feel that's why we do this, right? Is if you're going to spend all this time developing these great programs, you want to know it's what they actually need and that they're going to have an impact from it. So I have to say, career-wise, this is the closest I feel that I've gotten to fulfill that piece of CME that drove me here. I couldn't be a physician. I learned early on I could not stand the sight of blood, unfortunately. And I knew I was not going to be a physician. And so this is where I truly feel like I can still have an impact, and how close it feels right now is great.
And it starts with a scan. Deanna Heier, thank you so much for sharing your insights and wisdom with listeners of Right Medicine.
Yeah, thank you, Alex.